Welcome to All Things Chiropractic.
Welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
And I'm Dr. Mark Davini. Welcome, everyone.
All right, Doc, what are we talking about today?
Well, it's kind of an interesting mix of things that we're talking about. We're going to kind of merge the concept of the imposter syndrome and overconfidence.
Why do you look straight at me when you say imposter syndrome? How dare you?
I know. All the people in the audio don't get to see us, which one day will change.
I think people know what overconfidence might be, but what is imposter syndrome or phenomenon?
It's an old concept, actually. It's nothing new, but it's kind of getting new attention, if you might say that. But it's that feeling that you don't deserve your success, that in one way or another you're faking it. And even though every bit of what you see and hear and do is to the contrary of that. And so it starts becoming an issue in things like your practice, where you get your practice to a certain point, and then all of a sudden this feeling starts taking over and you actually sabotage yourself.
Well, but what about this concept of like fake it till you make it?
Well, now we're getting into the other side of the coin that we just mentioned, the overconfidence, right? So it's that balance between knowing what you know, do what you do it well, but have it clearly thought out in your own mind that you are who you are. And we don't see that often. I mean, it's kind of a strange thing.
And doing a little research on this, I was shocked to see how much research was actually out there on this with healthcare providers specifically too. I mean,
Right. Well, here's some common signs if you wanted to kind of look at it and say, okay, how do I know am I in this imposter syndrome / overconfidence dilemma, right? You doubt your abilities. No matter how much you achieve, you still think you need to achieve more. You keep downplaying your success. You throw the word luck out way too much, right? You overwork. You say, well, I need to do more and more and more. And somewhere along the line, you have this fear of being judged. So you know what you know, you say, you say, oh, I'm great at it. And then some situation comes up, maybe court, where you have to sit there and actually defend what you actually are and what you say. And you have this excessive fear about it because now all of a sudden somebody's going to look behind the curtain.
I often wonder, especially with like new grads, do they suffer from this? Are they, do they feel like, hey, I'm not that prepared for the real world? Or are they feeling, I don't know, docs, if you're new out there, are you feeling like, hey, school prepared me for this? Or maybe you've been around for a bit and you're like, yeah, school never prepared me for this. But how would school prepare you for this? I mean, it is about seasoning, isn't it? I mean,
Right. Well, again, there's like grades of knowing, right? And there's that, excuse me, that unconscious competent. That's the person who it just happens. They know it all so well. It just happens because they've perfected things. They've excelled in things to the point they know what they know. So they have that unconscious competence. And then you have that unconscious competence. You have the conscious incompetent, where you are aware of the things you don't know. And that's kind of in the middle of your growth pattern where you say, all right, I don't know everything, but I do know some things. And so, but I need to learn more to get good at it. And when I get good at it, I become the conscious competent. I now know what I know. I may need to know more, but I now know what I know. Students who graduate are in that unconscious incompetent phase. They don't even know what they don't know.
right. But it seems to me that the education system for chiropractic almost sets up the graduate for this because, we recently talked to Dr. Bill Owens, right? And he talked a lot about the differences in education where a medical student when they graduate, they go into a residency. So they know they don't know squat in a sense. They got the foundation, but they have to go through the experiences. But they have mentors and others there to support them. With chiropractors, you graduate, most of them will either associate with a doctor, and which means they're probably working opposite hours to expand the office hours, or they're in a silo and they work for themselves and they don't have that kind of opportunity for years like in residency, right? So
Yeah.
the system seems to be built to sort of shepherd this kind of fear of failure and fear of being inadequate.
Well, we do externships. We don't do internships. We do an extern while we're still in school. We practice while we're in school. And the problem comes that we, like you say, once we graduate, we don't have that ego building period of time where somebody like the military, when you start doing internships in medicine and fellowships and all of that, they break you down and then they build you up. And then they build you up from the ground up so that they know you know. We have to do all that on our own.
Yeah. So, unless they change the whole format of how a chiropractor becomes a chiropractor, I mean, we're left with, right, what? We're left with trying to connect with our peers, which I don't think chiropractors do at all anymore like they used to, right? There used to be the days
No,
where
not at
you'd go
all.
back to your hometown, you'd be welcomed by the chiropractors in the area because there weren't that many. You'd share adjustments, you'd check in with them, you maybe join your trade association. They might have local chapters or state functions where you get to know everybody and you get a support system around you. But I think today there isn't that connectivity. I mean, tons of it is just online now, right? On demand. Nobody wants to be in person, so there's that battle. But also there's the feeling of, hey, there's a new chiropractor in town. They're going to take patients away from me. You know?
Oh, and it's so true, and we all have to come out of school, and we all have to have a certain amount of confidence in what we do, or we wouldn't be able to do it, and some of that may be put in the realm of overconfidence in a sense that it's not backed up by experience, it's not backed up by, extended knowledge, it's basically you learn what you learn in school, and you come out and you start practicing it. I always found that word interesting. It's not doing, it's practice, right? So we come out and we keep practicing what we know to the point where we become that either conscious competent or the unconscious competent. So the situation with a young doctor coming out right now is they have to have a certain amount of, we'll say, unsubstantiated confidence, and the schools have to build them up enough to be able to go out and do what they do. But if they don't continue to learn, and if they don't pay attention to these things that we're talking about, like today, and other things we've talked about in our podcast, they just fall into this rut. And how many times do we go into an office and we start asking some very basic questions, not about all the stuff nobody cares about, but I'm talking about like basic clinical questions. Why do you do what you do? I ask this question all the time and it blows my mind that I don't get clear answers. What is it that you do to determine when and when not to adjust?
Mhm.
And then I got to go through this hamana thing for the next 5-10 minutes before they finally arrive at some kind of loosey goosey criteria that they have to determine when and where to adjust. And I'm not saying that happens to everybody, but I'm saying it happens way too much. So if they're trying to tell you, getting back to the imposter syndrome thing, you got to remember just innately in our name, our title, we call ourselves doctor. So do you own that? Do you own that title? So every time you say, I am Dr. Mark Davini, do I believe it? Or am I just saying that to portray a level of confidence that may or may not be
Yeah.
substantiated?
It could be a little of both. Probably
Right.
the more you're in practice, the less you feel fraudulent about it. But you know, in looking at some of the research, it was crazy to see that between 60 and 70% of healthcare providers uh, had these feelings of feeling like an imposter or feeling like they're not qualified or they're going to fail. Like it was an amazing amount. And some of the research talked about how it ends up sort of influencing the caregiving, the
Right.
recommendations, the treatment. Wow.
Yeah. But we get beat up a lot, so, the old joke, we're the O doctors, right? So you introduce yourself as Dr. Mark Davini. What's the first question somebody would say? Oh, really? What kind of doctor are you? And you say, I'm a chiropractor. And they go, oh, we're the O doctors, right?
Uh,
And, that erodes your confidence. So what do you do with that? Do you regress or do you go forward? Do you become overconfident or do you stop saying I'm Dr. Mark Davini?
Well, that's a good question because I start to wonder too, like, with a large majority of chiropractors that leave the profession after a certain period of time.
Mhm. Yeah,
And, you can tie it to perhaps a lack of success or a lack of financial gain or burnout. But some of the things that you attributed to are the characteristics of this imposter phenomenon.
sure.
But
We
let's
do
talk.
it, right? I mean, we do it in recent years examples, right? When everybody was referring to Joe Biden's wife as Dr. Biden, everybody's mind went to medical doctor. Then
I
you
think,
find out she's a
yeah.
PhD in education and your mind goes, "Oh, geez." So she certainly has the title doctor, but now your mind, even our minds, everybody's mind goes to, "Well, should she really go around calling herself doctor? Because
Yeah.
that
I
puts a
mean, I
different
think,
impression." And so
yeah.
we struggle with that on a lesser level
If you're in
because
a
we do treat
Yeah,
people.
if you're in a like a collegiate setting, it makes sense to call your
Right.
professor doctor or whatever. Well, my wife's she's in the last semester of her doctoral program as an occupational therapist. And I joke with her, I'm like, I'm gonna introduce you as Dr. Deirdre Andrews to everybody as soon as you graduate.
Yeah. And
You
and
know?
it's a true statement.
Yeah. Well, every
It's a true statement.
every every lawyer is a Juris Doctorate, right? So you could call them doctors,
Exactly. So
you know?
what I'm saying is, though, everybody's mind is in that place at a different level. And it goes all the way from, I really don't want to say it, to I say it in a way that maybe portrays a different model. It's the person who advertises, and nowhere in the advertisement are you identified as a chiropractor. I am Dr. Davini, doctor, but nowhere in the advertisement do you put the word chiropractor in there. Why is that?
Here's a question. Would I be considered imposter phenomenon if I changed my first name to doctor and then you had to call me that?
Yeah. That the old joke used to be that in I think it was Australia or New Zealand, one of them
Yeah.
when I went to school, they weren't allowed to call chiropractors doctor, and one person that we know of did name his son, his first name was Doctor.
Yeah.
So,
Hey.
yeah, yeah. And I had a good friend in college whose last name was Doctor, and he
Yeah.
became a PhD in genetics, so he was Doctor.
Yeah. It might be worth the trouble just to do that. I don't know.
Yeah, yeah, some of it's just fun. It's better
In
than
you know,
Doctor
in,
Bone Break, yeah.
in the service they call it stolen valor. What is it called? And with stolen credentials? Like,
Stolen credentials, yes, stolen credibility.
Yeah.
Because let's face it, we all use the title as a way of gaining credibility, and what we're saying here is make that credibility real in your mind, and if it's real in your mind, it'll be real in everybody you say it to. If it's not real in your mind, no one's gonna buy it.
Let's talk about the other side of the coin for a second. Let's talk about that overconfident doctor. And I'll just paint a quick picture. Like my vision of it is doctor who's been out for a bit and they really haven't been, as I call it, like kicked in the stomach business wise or professionally. They're doing pretty well. They're rocking it. They're feeling good. Nothing's really stopped them or any speed bumps. So they start to feel pretty robust in their abilities and their clinical skills, business skills. And maybe that lack of getting humbled along the way can create an overconfidence. And I bet I'm going to ask you this. I bet you have seen it in recent years because of your medical malpractice defense work. Have you seen that overconfidence sort of play into someone who got into a problem?
Oh, absolutely. And I'll tell you a little story, but about a friend of mine who kind of put this to me. I had a patient who was actually his patient, and the patient came to me after treating with this chiropractor for a bit because they weren't getting the response they wanted. And then later on, he comes to me, and I start treating him, and the patient did a little better than what he did with this other doctor. And so we're meeting, we're talking, and he says, "Oh, so and so came over to you." He said, "Do you know why you got him well?" Right, and I looked at him, and of course, in my mind, with my overconfidence,
Uh-huh, uh-huh.
thing going, my mind's going, "'Cause I'm a better chiropractor than you."
Uh,
And his answer was, "Because you didn't know enough to know you couldn't."
oh.
And I went, "Oh my god." It's true. I dove in, and essentially, he knew so much about the risks and the potentials and maybe the outcomes because he's treated 100 just like it, and he was almost being more honest with the patient and maybe conservative with the patient. And what he needed was someone who didn't know what the hell he was doing, go in there and just crank away and
Yeah.
and and you know get away with it in a sense, right? Get away with it. And so it's true that in those beginning stages you don't think about everything. So to go back to your question, yeah, god, once I got on the state board, and at the time, so now I'm looking at all the rules, all the regs. What am I doing? Am I doing it right? And at the same time, I was doing my diplomat in neurology. So now there's all this new information being poured into me, right? So I got all this information plus all this new risk management mindset going on at the same time. And you realize, oh my God, at that point, I'd been in practice almost 10 years. And I found out how little I really knew on so many levels.
I'm gonna isolate that one soundbite right there.
Yeah, yeah, yeah. That's
Thank
gonna
you.
be what you play over and
Yeah.
over again. How little I really know.
Thank you for that gift.
Okay, thank you everybody for
Yeah.
joining us for all
Yeah, right.
Oh, you
Well, yeah.
guys think it's easy. You
Yeah.
guys out there think this is easy, right?
So I'm thinking about it. Have All right, so 2 things. 1, when you have done continuing education or your colleagues, people you know, and these sort of aha moments happen at certain CEs, like you really connect with an analysis or a method or a technique, and then you, like, go in Monday morning and you're just, like, on fire about it. But perhaps you haven't assimilated all of that yet, and you get this overconfidence about this new thing that maybe you didn't realize, you're going a little too fast, let's say, before you're seasoned in that. Have you ever seen that kind of experience or experienced that yourself where you're like, maybe I need to pull off the gas pedal because
Yeah,
you
I go both ways. Sometimes you have to pull back and then maybe sometimes accelerate. It's sort of the same thing like the human body, right? What is the body like? It likes homeostasis, right? It wants to be in the middle, doesn't like extremes, either too much or too little. So when you look at the imposter syndrome, you're looking at too little. You're overcompensating for things that you may know or may not know, or at least don't think you know enough. I always need more and more and more and more so that I can justify what I do and feel better about myself. And you got the overconfidence where, nah, I don't need to know any of that. I know that what I do works and that's good enough for me. And both extremes go along to get along. There are people who practice their whole life at both ends of the scale, never have an issue. And then there are those who are in the, in between somewhere and may either have an issue personally, just because you say, I just need to know more, be better, whatever, or maybe something actually did happen where the too little or too much hurt you.
I was recently at a professional conference and there was an attendee talking to a vendor who had uh, an injury. And this person kept saying, like, "Oh, I can get you better. I
Mhm.
can do an assessment. I can do this. I can do that." And I'm just witnessing this going, you know, you're making this about what you can do for them, not I mean, what your abilities are for them versus how can I assist you in healing? How can your body heal itself, as chiropractors say, and others. It was just like this ego trip that I was watching, And I'm saying to myself, that person is so overconfident in what their abilities are. One, to me, they were advertising far more than they can do. And secondly, they weren't really making it about the person they were talking to. It was just about them challenging that person to say, "Hey, let me make you better.
Right.
Let me do this
Let
for
me
you."
do that.
And I'm
I think
looking
it's the
at it.
difference between I'm sorry, go ahead.
I'm just looking at it and saying,
Yeah,
well, the phenomenon of imposter syndrome and the issue of overconfidence or being too cocky, they're they're sort of both sides of the same coin. You're making it about you.
right. And, I agree, and again, let's even parse out the difference between confident and overconfident. So if you're confident, it's based on the reason, hopefully good reasons. You know what you know. You have a command of your information, of your abilities, of your skill, your communications, whatever. I had a friend who became a chiropractor because at one point in his life when he was younger, he has extreme right lower cramping type pain, right lower quadrant abdominal pain, right? Most of us would think appendix, right? He needs an appendectomy. Goes to the hospital, and that's what they diagnosed him with was appendicitis. He had a friend who was a chiropractor. Chiropractor visited him in the hospital and talked to him a little bit, and he said, "You don't have appendicitis. Get your ass out of that bed and we got to go to my office and we'll fix this." Now, was that overconfidence or confidence? So
That was a
takes him back
boilerplate
to the
waiting to happen.
office. Yeah, takes him back to the office, and, this was him looking at the chart saying, "You have no elevated white cell count, you have no fever, blah, blah, blah. You don't have appendicitis, they're misdiagnosing you." He treats his ileocecal valve, and the pain went away almost immediately,
Yeah,
and that's what made him look into becoming a chiropractor, because he became a very renowned kinesiologist, in the field
yeah.
of kinesiology and chiropractic, and now, was that doctor being overconfident or confident? He didn't just say, "Oh, I'm a chiropractor, I can cure everything." He looked at the chart. He had a clinical base of knowledge that he called upon, came to a conclusion different than the quote real doctors, right? And said no. And
I
you
can
want
tell
to
you
know
what he
something? I
had.
had that same experience, only I went the opposite. I went into the hospital with right lower quadrant pain. I was only 12 at the time, and I never had a fever, never had an elevated white cell count. I'm behind the curtain. I hear the two doctors talking, and one doctor saying, "I got to go in and take out his appendix." And the other doctor's going, "Well, he doesn't have an appendix. His white cell count is normal and no fever." And the other guy said, "I don't give a damn what the white cell count says. I'm going in there and seeing what's going on." And I'm like 12 years old instead of somebody arguing for me or me going, excuse me, can we talk about this?"
Yeah,
I was in surgery a half an hour later
yeah.
and they took out my appendix.
Well, that doctor had a lot of balls, I can tell you that, to go into a
Confidence,
hospital.
confidence, yeah,
Yeah.
confidence. And
Dude,
the irony of it is we know as chiropractors that if you go in there and just start poking around and manipulating the bowel enough to pull out my appendix, you probably influence the ileocecal valve and relieve the situation anyway.
but but look at that. If that happened in today's world, there would have probably been a board complaint, an investigation, a scope issue. I
Yeah.
mean, you name it, right?
Would you have the confidence to pull somebody out of a hospital bed? I
I
don't
don't
think
know.
that even exists today
I know. I know.
because of
Security would
things
probably be
well,
called, right?
because of things we know, like
Yeah.
we're saying. So all of a sudden we have board issues and we have this and we have that, So it's a whole continuum of everywhere from feeling like the imposter because you either you feel like you don't deserve what you're getting, all the way up to I deserve this and more and I'm gonna keep taking it and there's no basis for it.
When you along the way in your long, illustrious, long career, have have you ever had, like, either in your office or maybe in, like, continuing ed, settings, clinical arguments with your colleagues? Like, clinical debates?
Yes.
I've
You know, um And it's kind of interesting as things evolved now where I do a lot of expert testimony. Um, I have one of the lawyers I work with, what she likes to do with me is let me pretend to be the other side. So I get to argue with my colleagues, but in this controlled setting where I would either pretend to be the board if it was a board complaint, or I would be the plaintiff attorney if it were a malpractice type of complaint, and I just drill the doctor, right? And it's kind of interesting how little time it takes to get them to contradict themselves. And this is what we're talking about, the difference between the imposter syndrome and the overconfident person, that somewhere in the middle, you should really think about what you do, why you do it, and have a rationale for all of it. If you choose activator, what's your rationale? Clinical rationale. You may not have one. You may pick it for other reasons. If you use drop tables instead of manual adjusting, diversified, Gonstead, or whatever, what's your rationale? If you do a mix, what's your rationale? If I treat this or that, what's your rationale? And what I have found is that chiropractors exist without rationale.
Does that come from their education, or does it come from, the lack of collegiate, uh, practice where they don't have their peers to lean on, experienced doctors?
I think they're just not told they're supposed to do it. They come out of school. I was taught everything I needed to know to think out what I wanted to do and how I wanted to do it. And then, of course, time I got better and changed and evolved and all of that. But I'm not going to blame the schools there. They did a good job. At least when I went to school, I let it go. When I went to school,
I was gonna go there, but it seems like
I
such a,
know,
you know,
but when I went to
easy
school, it was
target.
really, we were taught everything we needed to know, but you still have to go further. You don't just say, "This is what I do."
But
Why?
back then they had, like,
Because
1
I've done it
textbook
for
for
a
the
long
whole
time.
back then they only had, like, 1 textbook for the whole education, right?
Yeah, it was easy to memorize. So
Yeah. It was very little known back then, right?
so it took a long time
Yeah.
to get to know.
Yeah, yeah,
Yeah,
yeah.
but I don't think people think about what they do intellectually, just self-talk, self-analysis. I do what I do, what's the reason why I do it? And if you can always come up with, that reason. Perfect example, ask a chiropractor to define subluxation. We've talked about this before, and some will have that, boom, right off the bat, they'll have that nice elevator, 1 or 2 or 3 liner, and then other people start out with, "It's kinda like," and then you haven't even really stopped to think about what it is you treat, let alone how you treat it and why you would treat it this way as opposed to that way. There has to be reasons, and I think we get all too comfortable going along in life and not thinking about it, anything we do and why we do it. So think about it.
So, what are some of the takeaways? If you're out there, doc, and you're saying, "Well, some of this kinda resonates with me because I am sort of more than faking it till I make it. I feel as though perhaps I'm inadequate or
Mm.
I'm not seasoned enough." What would some of your, advice be as a
Well,
seasoned
it's
doc?
really your advice. I'm gonna piggyback off your advice. Get with your friends, your colleagues. Sit around and talk about what you do and make your friend, and your friend should make you, give you a reason why you do it that way. And you just have a nice exchange because it all comes down to like that story I told you about that friend that told me I didn't even know that I couldn't get this person well. Well, that was impactful in my life because it made me think, well, what don't I know? And what did I think I knew to let me do what I did, ignoring what he knows, you know? And so it really came from just conversations. Just like you said, don't be afraid of your colleague, embrace your colleague and learn off each other. This when I practiced in an area when at the one time there was only 3 chiropractors in the area. And So I sell my practice literally two doors down where my old office was. I had moved from one office to the other. I had a chiropractor call me up and ask if I would mind if he rented my old office. Wasn't mine to rent, but he didn't want to impose if I felt that was infringing on my space. I said, no, please come on down. Right. Not too many years later, someone opened up literally the door next to him. So within 150 yards of each other, 200 yards of each other, we had 3 chiropractors. And you wanna know something? We all did well.
Did that guy or girl knock on the door to say, "Hey, I'm moving in," or no?
Called me up, we were friends, called me up and said, "I'm thinking of renting your old space. Is
No,
that
not that. The
something?"
one that
Oh,
moved in, a couple of years later, you said showed up, right? Didn't you say they called you, but then somebody else moved in after that?
oh, no, then another chiropractor moved one door down from
Yeah.
him.
Did that
So
other chiropractor
I don't
knock
know
on
if
the door?
I was gone by that point, so
Yeah. Well,
the
do you know
person
if
who
they
bought
talked
my
to him? Because
practice
my point is
yeah. They don't
that
talk
doesn't
to each other,
happen.
though. They just,
Yeah.
"Oh, have you ever talked to Doctor so and so? Oh, yeah, I met him. Yeah, he's a nice guy, or she's a nice woman," but the whole point was no communication.
Well, that's it. Because you said, your advice was to talk to your colleagues, but I'm not sure how many chiropractors who are newer actually do that,
No, that's what I'm saying. That's the
you know?
advice. That's the point of if you're gonna walk away with one thing from what we're talking about here is communicate to your colleagues, challenge each other to mm, to come up with reasons and rationales for everything you do, because that could be the person that's the expert against you someday. You never know, because that happens, unfortunately. So you want to know what other people think, not just what you think, because what you think may only be to a certain level, and you may exist in that unconscious incompetent stage forever.
Right. Yeah. I mean, as you say, it's practice. It's not perfect. So continue to develop yourself, and that I think that confidence will come. And if you're overconfident, look out because
Yeah.
that speed bump is probably coming.
Yeah, do you know how you know you're overconfident? You
How?
don't think you need to know any more than you know.
Well,
That's a sure
that
sign
leads
you're
me to
overconfident.
a famous quote from Socrates, right? The
Yeah.
only true wisdom is in knowing you know nothing, right?
Exactly,
Right.
exactly. So
And just for our our geeks out there, Mr. Spock would say logic is the beginning of wisdom, not the end.
right. The more I learned I didn't know.
Yeah. See,
Simple as that, right? So,
he said it again. There's a second
live long and
soundbite.
prosper.
Excellent. All right. Well, that was good.
Yeah.
Yeah. Who knew?
Now I
Right?
feel way more confident that I can go forward
Yeah.
and know what I need to do to develop more confidence.
I lost my self esteem along the way. I don't know why. I was kidding.
Oh.
All right. Well, thanks again for listening to another episode of All Things Chiropractic. I'm Paul Andrews.
I'm Dr. Mark Davini.
Exactly.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.